depression is pretty common in my patients as well as generally in the population.
Mhm.
And is that still the number one problem that you are seeing in your clinic, or something else has taken over at this time?
No, depression is definitely one of the biggest diagnoses that I see. The issue, again, is that we are very busy individuals. I haven't looked at the quite the research. Of course, it is we as Americans are more open and there is more awareness. So we talk more about it too. I don't know if that plays a role in
Mhm.
Americans having diagnosis of depression more or not, but definitely our lifestyle, which is our in our society, our culture, which is very individualistic, isolates you. There's a lot of reasons why people are getting depressed. Of course, there's a biological genetic reason behind it, but a lot of it is situational depression. That's why the whole balance and the holistic care is needed, right? Because medication is going to help lift the depression a little bit, but you still have all those stressors that are keeping you at some level of what we call dysthymia, right?
Mhm.
So there's a depressive episode, but then there's like a level of dysthymia where you're supposed to be, this is normal, but you're down here. And that's where you always are. If you have a
Mhm.
depressive episode, then you fall further down, right? I think that's very typical. It's more typical than it should be. And just recognizing that's what's going on and taking steps. First thing is to realize that you have dysthymia or
Yeah.
depression, right? And then go from there. But this is like the major issue. And I know one of the things, like, we're both physicians. I think one of the things is that, like, in our physician community, it's so common. And then mental health is such a taboo. If somebody is seeing a psychiatrist or a therapist, it's such a taboo. But like recognizing that, and burnout, right? We talk about burnout a lot. We just talk about it. We don't do anything about it. That's the biggest issue. But what is burnout? Burnout is actually a type of depression. It's just
Yeah.
an easy way of saying it so that physicians don't feel bad that they're depressed, right?
Yeah.
That's
Yeah.
what burnout is.
Yeah. Yeah.
You're working a lot, and like your situation, whatever is going on, you're starting to get depressed, and that's what burnout is.
Yeah.